Hi, my name is Bruno Silva. I'm one of the dentists at Brighton Implant Clinic. We're making this short video today to basically hopefully help and explain a little bit about what dental implant treatment is, what we do, and how it can help patients literally get their function and their smile, and more than anything probably their confidence back after losing teeth. So as one of the dentists here, often get asked questions about how the treatment's done, how many stages, how many appointments are required. So hopefully this video will help you if you're thinking or considering having dental implant treatment. So I'm going to be talking about a case of someone who's coming to see us this morning. This is a gentleman, he's 73 years old, and he's come to see us because his main complaints is he's having some problems with missing teeth. So over the years he's lost some teeth, and these have been gradually added onto a removable denture. Removable denture is essentially false teeth, and he's finding these false teeth to becoming quite uncomfortable. So this initial assessment, we're basically ensuring that patients' mouths are healthy. That includes basically checking the oral tissues, the tongue, the roof of the mouth, also checking for any areas of decay. Ideally, these should be treated before any dental implant treatment is commenced, and also very important to ensure that the patient's not suffering from any gum disease, also known as periodontal disease. Right, so once we've assessed and we've checked that everything's okay, then the patient's main complaint, which is obviously suffering from multiple missing teeth, we've basically looked at different solutions for treatment. So each solution, there can be many different alternatives to treatment. Each one will have advantages and disadvantages. And just briefly, for example, in a case like this, we're looking at the patient's x-ray. We've got the upper teeth and the lower teeth here. This is called a panoramic radiograph. And we can see in the lower jaw, there are multiple teeth missing. We've only got about 4 teeth, natural teeth in place. And we can see that in the upper jaw, there's been quite extensive dental treatment carried out before with some crowns and bridges in place. The options of treatments in this case would be essentially to either remake a new removable denture, which would have a slightly better fit and to try and adhere more to the natural teeth, but essentially it's still going to be a removable prosthesis. And from this patient's initial discussion, the main issue here was really to try and get rid of the denture completely so that you'd have something like fixed teeth, which dental implant treatment could offer. So the treatment that we're recommending is called Teeth on 4, and essentially we're going to be placing a minimum of 4 implants into the patient's lower jaw. This treatment is done under sedation. We also use local anesthetic. We carefully remove the natural teeth, and during a procedure that takes about 3 to 4 hours, we'll be placing the 4 implants where the patient has good amounts and volume of bone. So it's quite important that during this procedure we are able to assess the stability and the strength of how the implant is placed in the bone. In some cases we may see that the stability is not sufficient, and this would have implications on the length of treatment or how the treatment is carried out. I'll come back to that in just a few seconds. So the idea is to place the 4 implants, and provided that the stability is adequate, we will then be taking some impressions immediately after the surgery. These fixed teeth are essentially screwed onto the implants, and the patient will then be able to have a fixed bridge which is 10 to 12 teeth that he'd be able to function with his upper natural teeth. So just going back, in the event that we place the implants and we see that the bone density is not very good, and if the implants are not as stable, then we'll have no option but to leave these implants submerged underneath the bone, and it will require a 3 to 4 month healing period. During that time, instead of the patient having fixed teeth, he'd have a removable denture, and that removable denture would basically be not placing any pressure or any stress on the implants while they're healing. So we're going to carry out the surgery, and then we'll come back afterwards with a report of how the surgery was carried out and I'll elaborate a little bit more. I'm back, and I'm very happy to let you know that the surgery's gone actually very, very well. And the patient was very comfortable. The surgery was really, really very nice. After the patient was sedated, we removed the lower teeth, and as you can see from this x-ray, we actually placed 4 implants. The implants were very stable, and as I mentioned in the first part, because the implants were adequately stable, we are able to measure that with a specific device that actually gives us a specific reading of how stable the implants need to be. We were able to take some molds, some impressions, to basically have a fixed bridge made. That bridge is made in our dental laboratory, and it consists of 10 teeth. And as you can see over here, it's indicated by this little bar, which is just reinforcing that bridge. The bridge is made out of a acrylic type material, and it's screwed by means of 4 small screws to the 4 implants. Now, during this next phase, this is essentially the healing phase, or the osseointegration phase. What's going to happen is the bone tissue is hopefully going to bind to the titanium surface of the implant. And that bond is extremely strong, and it will then just further strengthen the capacity or the capabilities of these implants to support the fixed teeth. So the next appointment is going to be a week's time for a review. Make sure that the patient's coping well, and we will then ask the patient to come back and see us in 2 months afterwards. And after 2 months, what we'll be checking is we'll be actually removing the bridge. The bridge is actually very easy to remove. We don't need to use any local anesthetic. And underneath the bridge, we're going to make sure that the patient is cleaning adequately to keep the implants hygienically clean. It's very important that when the surgery is finished and the patient starts to function with dental implants, to obviously go over the hygiene processes of how the bridge needs to be cleaned. And you may see from one of our other videos, we actually we give patients what's called a water jet. And this water jet is essentially like a water pressure little device that actually cleans underneath the bridge. It's very important because it kind of replaces what would be a normal toothbrush for natural teeth. So underneath this bridge, there's a very small gap, and we have to ensure that the water jet is actually jetting water underneath. After 2 months, as I said, we'll take the bridge off. We'll make sure that everything's okay underneath. And then if everything's fine and we're happy that the implants are healing adequately, we'll place the bridge back on, and we'll leave the patient for a further 2 months to allow for healing. And the final appointment, or rather I should say the final stages of the treatment, would then involve actually the changing of this provisional bridge to a fixed bridge. So the provisional bridge is essentially to keep these implants splintered or essentially held together. During that 4 months, often patients will come back and they will tell us that they want to make some changes to their teeth, either to make them slightly larger or smaller, or they can change the color of the teeth or the shape or the position. So we take all those factors into consideration, and we then take the final impressions once everything is healed, and a new definitive bridge will then be made. And this is after 4 months. So it's a little bit ahead of where we are at this stage, but it's just to give you an idea of kind of where in the treatment line this appointment is. So this is kind of the biggest amount of surgery, probably 80% has now been completed. Now we're going to be waiting for the implants to heal, to integrate, and then if all is well, after 4 months we'll start making a definitive bridge. Just a little comment, this is actually a wisdom tooth. We left it in place because it wasn't anywhere near where the implants needed to be placed, and it's not too close to this nerve that runs in the lower jaw, so it's not going to help us in any way to remove it. So we decided just to leave it in place. The patient doesn't have to go through the discomfort of having a tooth like this unnecessarily removed. So we will be placing, doing another video of once the final bridges or the definitive bridge is made after 4 months, and you can see that it's going to come in part 2. So thank you very much.